everyone, welcome back. Ready to dive into a really important topic today. We're talking about breast cancer, and I've got this really in-depth article here from the Advocate Voice. Breast cancer in 2024. Understanding symptoms, risk factors, and treatment options. It's a lot to unpack.
It really is, and it's something that touches so many lives. Did you know that this year alone, they're expecting over 2 million new cases worldwide?
Wow, 2 million. That's a huge number. And it's easy to think breast cancer and just picture like finding a lump, but this article really digs into all the nuances and it's honestly kind of
Oh,
eye-opening.
absolutely. Like, take ductal carcinoma versus lobular carcinoma, for instance.
Okay, yeah. Those are always kind of like medical terms you hear tossed around, but
Right, but when you actually understand that ductal starts in those milk ducts, whereas lobular begins in the glands that produce milk, it makes you think about it differently.
it totally does. Like understanding where things are actually happening in the body makes it click.
And that's key, because that difference can really impact how breast cancer is even detected.
Oh, that's interesting. So how so?
Well, with lobular carcinoma, you might not always feel a distinct lump, especially early on. So this whole emphasis the article puts on self-exams, it's so important. It's not just about finding a lump, it's about knowing your body, any changes at all.
That's such a good point. It's that whole being proactive, not reactive thing.
Exactly.
And speaking of things we might not expect, the article mentions this thing called peau d'orange.
Yeah.
Literally, it means orange peel skin as a possible symptom. Have you heard of that?
I have. And it just shows why we got to stay informed about like all the different ways this can show up. Peau d'orange, it refers to like the texture of the breast skin changing. It might look dimpled or pitted, kind of like, well, like an orange peel.
That's such a visual. It makes you realize there's more to it than we might assume.
Absolutely. And this actually leads into another thing that the article does a great job of explaining metastasis.
Okay, metastasis. That's
Remind me again.
so imagine cancer cells, like tiny seeds that can spread through your bloodstream or lymphatic system. That's essentially what metastasis is.
Oh, right. So we want to catch it before it has a chance to, like, spread those seeds. Exactly. Early detection is key. And that's why this whole discussion is so important. Equipping ourselves with the knowledge to understand our bodies, recognize those potential warning signs, and really advocate for our own well-being.
I love that feeling empowered. So we've gone beyond just that image of a lump and seen how breast cancer can present itself in different ways. But I know what you might be thinking. What are my risk factors? And we'll be uncovering those right after this. Okay, and we're back. Let's get into those risk factors because I know after that last segment I was definitely thinking about my own risk. But this article had something really reassuring.
Yeah, that 85% statistic, right?
Yeah, exactly. They said 85% of breast cancer cases aren't directly because of family history. So while genetics definitely play a role, it's clearly not the whole story. It's kind of a relief, honestly.
Right, kind of takes the pressure off a bit. And it lets us focus on those other factors, the ones we actually have some control over. But we can't talk genetics without mentioning the BRCA1 and BRCA2 genes.
Right, those are the ones you always hear about.
They are, and for good reason. So basically, these genes help suppress tumors, right? And mutations in these genes can really increase your risk.
So mutation is like what? A glitch in that gene makes it not work as well.
Exactly. Like, think of it like a smoke detector with a faulty wire. It might not always catch the problem as early as it should, and everyone has these genes, but having that BRCA mutation, well, it means you got to be extra vigilant about screenings. Talk to your doctor about what's right for you.
It's all about being proactive. Knowing your family history is important, but it's not the only factor, which is good news. And speaking of things we can be proactive about, the article talks about how lifestyle choices play a role too, right?
Oh, absolutely. Like, did you know there's actually a link between the Mediterranean diet and a lower risk of breast cancer?
Wait, seriously. So eating like olive oil and veggies and stuff is actually good for you in this way too.
It seems that way. I mean, more research never hurts, but it's a diet that's good for you overall, and now there's this connection to breast cancer prevention too. It's pretty amazing, right? But then the article also goes into some of the less obvious things, like exposure to BPA.
BPA, like the stuff in some plastics. I never would have thought about that.
It's one of those hidden things. See, BPA is what's called an endocrine disruptor, which basically means it can mess with our hormones. And we know hormones play a part in how breast cancer develops.
So it's like we have to be mindful of those everyday exposures too.
It's all connected. It's about understanding the big picture and making informed choices.
Mm.
And speaking of taking control, let's move on to a topic that lets us do just that: early detection.
All right, so we've talked about what breast cancer actually is, those different types, and then all those risk factors, the genes, the lifestyle stuff. Now comes the part that I always find really hopeful: early detection.
And it's hopeful for a reason. This article had a statistic that just, like, wow, a 99% 5-year survival rate if it's caught early when it's localized. Think about that, 99%.
It's amazing. It really shows you how important catching it early is.
It really does. And that's why understanding the screening options, that's huge. We always hear about mammograms, self-exams, but it can be confusing.
It's like, I know they're both important, but when, which one, it all gets jumbled up.
Exactly. This article actually does a really good job of laying it out. So mammograms, they use those low-dose x-rays, right?
Yeah.
To find things that might be too small to feel. And they recommend yearly mammograms for women, let's see, between 45 and 54. But, and this is important, talk to your doctor.
Because everyone's different. Right.
Exactly. Your risk factors, your family history, all that plays a role in when you might start screenings.
Okay, so it's not like one size fits all. What about self-exams then? Are those still important with mammograms being so common?
Absolutely. They're like your own personal way to know what's normal for you. No one knows your body like you do, right? So yeah, mammograms are great, but those self-exams can help you catch changes early on, things a mammogram might not even pick up yet. It all goes back to that proactive thing.
I love that. Knowing you're normal. Okay, and I know this can be a tough topic, but the article also talks about preventative surgery, which I imagine that's a really hard decision.
It can be, definitely. But this is another area where that whole personalized approach is so crucial. So they usually only really consider something like a mastectomy, which is, well, a big surgery for people with a very high risk, like those BRCA mutations we talked about.
So it's not for everyone, just in the specific cases where it might really make a difference.
Right.
Okay, so we've covered early detection, but of course, that's not the end of the journey. The article talks a lot about treatment options, and I know this is where it can get really overwhelming.
For sure. There's so much out there now, which is amazing, but it's a lot to take in. The article goes through the main types: surgery, radiation, then chemo, hormone therapy, even newer stuff like immunotherapy.
It's almost like picking your path, but with expert guidance, of course.
I like that.
So maybe instead of going down every single path, are there some key points we can hit? Kind of like a cheat sheet for everyone listening.
Love that. Okay, let's do it. Let's start with surgery. That's often the first step, right? So one thing the article mentioned was hypofractionated radiation. Sounds kind of scary.
Yeah, not the most reassuring name.
I know, but actually it's good news. It basically means they give you higher doses, but over a shorter time period. So fewer trips to the hospital, back to your routine faster.
Oh, okay, so less intimidating when you put it that way.
Yeah.
Anything to make that treatment process easier.
Totally. Now with chemotherapy, they don't sugarcoat it. There can be side effects. But what's important is that supportive care has gotten so much better. So they have meds for nausea, ways to help with fatigue. It's all about making the experience as manageable as possible.
That's so important. It's not just about treating the disease itself, but you as a whole person going through it all.
Exactly. And speaking of treating the whole person, hormone therapy. This one's especially good for cancers that need hormones like estrogen to grow. So we're talking hormone receptor positive cancers.
So it's like cutting off their food supply, those cancer cells.
Exactly. Blocking those hormones can really slow things down, even stop the cancer from growing. It's pretty amazing.
It really is. And then there's immunotherapy. That one always sounds so futuristic to me.
Right, like something out of Star Trek. But basically, they're training your own immune system to fight the cancer cells. How cool is that?
That's incredible. So we've got surgery, radiation, chemo, hormone therapy, immunotherapy. It's a lot. But I guess the important thing is there's not just one path that everyone follows.
100%. And this article really drives that home personalized treatment. That's what it's all about. So your doctor, they look at everything, the type of cancer, the stage it's at, your overall health, what you want, and they come up with a plan just for you.
Feeling empowered to make those decisions, that's what matters. And that actually leads to another thing I loved about this article. It doesn't shy away from the emotional side of this whole thing. Because getting a breast cancer diagnosis, that's scary. It's uncertain. It brings up all these feelings.
It absolutely does. And it's okay to feel all of that.
In this article, it's like it gets that. And it doesn't just stop at saying, yeah, it's tough. They actually give you things you can do about it. Like, did you know a lot of cancer centers now have something called integrative therapies?
Yes.
It's fantastic.
What exactly are they, though? So it's all about that whole person approach we talked about, right? But this is about more than medicine. Think acupuncture, yoga, meditation. even things like art therapy, music therapy. It's all about managing the stress, that anxiety, and just boosting your overall well-being throughout the whole thing, treatment and beyond.
Yeah, that's amazing. It's about more than just surviving, it's about thriving.
Exactly. And we can't forget about support groups. Both online and in person, they can be lifesavers, really. For patients, for their loved ones, being able to connect with others, share their experiences, it makes a world of difference.
That feeling that you're not alone, it's huge. So, as we wrap up this deep dive, if there's just one thing you take away from all of this, let it be this. Knowledge is power. Understanding breast cancer, all the ins and outs, your own risk, it's the first step to really taking control of your health.
Couldn't have said it better myself. And remember, early detection is absolutely key.
If you're due for a mammogram, schedule it, and if you're not sure, talk to your doctor.
Absolutely.
And to everyone listening, thanks for joining us for this deep dive into breast cancer. Don't forget to check out the full article from the Advocate Voice, Breast Cancer in 2024, Understanding Symptoms, Risk Factors, and Treatment Options for even more information. And until next time, take care of yourselves.